So this is our operating room. Just do a nice quick fanning there. Okay, this is our robot right here. It is called the Da Vinci robot, and those arms down there are what have attachments to some long arms I'll show you in a minute, and that's what goes inside the body. So you got 4 areas here, 4 arms that can go inside the body using some arm attachments. The Da Vinci robot used for laparoscopic surgery to go into really deep angular spaces. And then we have some supplies over here, gloves, and then sharps containers and alcohol, computers for the nurses. And this is called a Mayo stand. It's just a stand that has supplies for the surgeon. And then we have our cabinets here that have all the supplies that we need. Most of the supplies, because we still have to go outside sometimes to get some more supplies, but like sutures and bandages and gloves and catheters, all kind of stuff in these cabinets. And this is also part of the Da Vinci. This is kind of like a video game. So the surgeon sits there, puts their eyes through those little holes, and uses these. This is what they play with. Basically, they stick their fingers in there, okay? And they hold on to this, and they guide the attachments into the patient's abdomen, thoracic cavity, what have you. And these are laundry and trash bins, Mayo stands, and our stand where we put all our supplies for the case. And then these are the attachments I was talking about that go inside that Da Vinci robot. As you can see, they have little, right there, it looks like little snippers, cutters there. And they attach to the arms of that Da Vinci robot through here, okay? And there's different types and different sizes, and they're all kept back here in our cabinets. And then there's more supplies here for the surgeon. And then we're gonna go over to the anesthesia side. More gloves, as you can see. This is where we waste all our controlled substances. And then we have supplies in here. Anesthesia supplies, you've got some flushes, you've got some stopcocks, you've got some tubing, all kinds of supplies. IV start supplies, ET tube. This is what goes inside your throat and sits in your trachea when you are intubated. And then we have spinal kits and epidural needles, spinal needles back there. And these are NG tubes that go inside your nasogastric, inside your nose, into your stomach, to empty your stomach. These are attachment to our glide scopes, which are our camera scopes. These are our spinal kits. And this here is called an LMA. It's a type of a breathing tube that sits above the vocal cords. It doesn't go inside the trachea. This is our anesthesia machine, okay? And we use anesthesia gases that you breathe in through your breathing tube. This is sevoflurane, this is isoflurane, some places have desflurane. And then these are our flows for oxygen and air and nitrous. Nitrous oxide is laughing gas, okay? And these are the monitors. And as you can see, they will show you patients, well, you can't really see right now, but they come up with the patient's blood pressure, heart rate, oxygen, and all that good stuff when the patient is hooked up through all these extra wires. This hooked up to our anesthesia machine is the circuit itself that has the mask that we put over your face before you go to sleep, and you breathe in a bunch of oxygen or a little bit of laughing gas. And with babies, we turn on the sevoflurane. And then this is what we use to ventilate. It fills up with air and we squeeze it and it gives you oxygen. And then over here we have our Pyxis, and we access it through some kind of thumbprint, fingerprint of some sort. Top drawers are controlled substances, your fentanyls, your morphines, propofols in some places. And then bottom drawers are extra drugs that are not controlled and extra supplies, sharps container. And then this is an IV pump that we use. Yes, anesthesiologists know how to use IV pumps like nurses. and we can use it to infuse propofol on this side and all other kind of drips on that side. And then this is a bear hugger. The ORs are really cold and obviously your body's exposed, so we put this on you. We attach this hose to some a plastic kind of cover that blows up with warm air, and we can obviously adjust it to keep you nice and comfortable. And then over here is obviously the OR bed. And there you have it, self-explanatory. Those are stirrups if you're having some kind of GYN surgery or hemorrhoid surgery of some sort. All that equipment that you see over there is part of the equipment that the surgeons use. It's got attachments for their laparoscopic, machines. And the laparoscopy TVs are right there, screens. There's one there, and there's another one here. And then there's one here. This one is more specific to the Da Vinci robot with all its attachments. And then of course we have the coolest lights right here. And boom, let there be light. And there you have it. This is the OR. Hope you enjoyed it.